Men's heart health is a topic that deserves attention at every stage of life. Today, we'll explore the crucial steps men should take in their 30s, 40s, and 50s to protect their hearts and maintain lifelong well-being. Heart disease remains the leading cause of death among men, but with awareness and proactive action, you can greatly reduce your risk and enjoy a vibrant, healthy life. Let's begin by looking at what's happening in your 30s. This decade is often marked by professional growth and new responsibilities. Many men in their 30s find themselves working long hours, often at desks or in offices, juggling deadlines, meetings, and the pressure to succeed. While ambition is important, chronic stress can quietly impact your heart health. Stress releases hormones like cortisol and adrenaline, which over time can raise blood pressure, increase inflammation, and contribute to unhealthy habits. Diet and exercise are two pillars of prevention during this period. When you're busy, it's tempting to reach for fast food or processed snacks. Yet, these choices are often loaded with saturated fats, sodium, and added sugars, all of which can harm your arteries and raise your risk of heart disease. Instead, aim for a balanced diet rich in whole grains, lean proteins, vegetables, fruits, and healthy fats like those found in olive oil, nuts, and avocados. Physical activity is another essential tool. The American Heart Association recommends at least 150 minutes of moderate-intensity aerobic exercise per week. That could mean brisk walking, jogging, cycling, or swimming. Regular exercise helps control weight, lowers blood pressure, improves cholesterol levels, and reduces stress. Even simple changes like taking breaks to stand up and stretch or walking during lunch can make a difference. Don't overlook the importance of sleep. Poor sleep is linked to increased risk of hypertension and heart disease. Aim for 7 to 8 hours per night and establish a consistent bedtime routine. Finally, avoid smoking and limit alcohol consumption. Smoking damages blood vessels and accelerates plaque buildup, while excessive alcohol can increase blood pressure and contribute to weight gain. Moving into your 40s, heart health becomes even more critical. This is the decade when risk factors often begin to appear, sometimes without noticeable symptoms. One practical step is to monitor your blood pressure regularly. High blood pressure, or hypertension, is a silent threat that can lead to heart attacks and strokes. Home blood pressure monitors are affordable and easy to use, and many pharmacies offer free checks. Cholesterol is another key marker. As you age, cholesterol levels tend to rise, especially if your diet is high in saturated and trans fats. Elevated LDL cholesterol, often called bad cholesterol, can lead to plaque buildup in your arteries, narrowing them and restricting blood flow to your heart. Schedule annual checkups to measure your cholesterol and work with your healthcare provider to interpret the results. Maintaining a healthy weight is vital. Obesity is a major risk factor for heart disease, and losing even a modest amount of weight can have a significant impact on your blood pressure, cholesterol, and overall heart health. Focus on portion control, mindful eating, and increased physical activity. Jogging, cycling, or joining a sports league can make exercise more enjoyable and sustainable. Lifestyle changes in your 40s should also address stress management. Practice relaxation techniques like deep breathing, meditation, or yoga. Make time for hobbies and social connections. Research shows that strong relationships can buffer the effects of stress and support heart health. If you have a family history of heart disease, discuss this with your doctor. Genetic predisposition can increase your risk, but early intervention can help you stay proactive. Ask about screening tests such as coronary calcium scans or advanced lipid panels if recommended. In your 50s, prevention and early detection become paramount. This is the decade when the risk of heart disease significantly increases, and symptoms may begin to appear. Routine checkups are essential, including comprehensive heart health assessments. These may involve electrocardiograms, EKGs, echocardiograms, or stress tests to evaluate the function and structure of your heart. Collaborate closely with your healthcare provider to monitor risk factors. Blood pressure, cholesterol, blood sugar, and weight should be checked regularly. If you develop conditions like diabetes or atrial fibrillation, follow treatment plans carefully to reduce your risk of complications. Lifestyle remains the foundation of heart health in your 50s. Continue prioritizing a heart-healthy diet, rich in fiber, antioxidants, and omega-3 fatty acids. Choose grilled fish, leafy greens, berries, and whole grains. Limit salt and processed foods and pay attention to food labels. Physical activity remains crucial, but listen to your body and choose activities that match your fitness level. Walking, swimming, and gentle resistance training can help maintain cardiovascular fitness and muscle strength. Family support can make a big difference. Talk openly with loved ones about your health goals and seek encouragement when making positive changes. Sharing healthy meals, going for walks together, or joining group exercise classes can make lifestyle adjustments easier and more enjoyable. Mental health is closely linked to heart health. Depression, anxiety, and social isolation are associated with a higher risk of heart disease. Don't hesitate to talk to a counselor or join support groups if you're struggling emotionally. Connecting with others and building a strong support network helps reduce stress and supports recovery. Medications may become necessary as you age. If prescribed blood pressure or cholesterol-lowering medications, take them as directed and attend all follow-up appointments. Discuss any side effects with your doctor and don't stop medications without medical advice. Stay informed about warning signs of heart disease. Classic symptoms include chest pain or discomfort, shortness of breath, pain in the neck, jaw or arm, and unexplained fatigue. However, symptoms can be subtle, especially in men. If you notice any unusual signs, seek medical attention promptly. Throughout every decade, simple habits can make a dramatic difference. Avoid smoking at all costs. The risk of heart disease drops rapidly after quitting. Limit alcohol to recommended guidelines and avoid binge drinking. Prioritize sleep, manage stress, and make time for relaxation and enjoyment. Heart health is a journey, not a destination. By making informed choices in your 30s, 40s, and 50s, you're investing in a longer, healthier life. Regular checkups, balanced nutrition, consistent exercise, and strong social connection form the foundation for lifelong well-being. Remember, taking care of your heart is one of the most important things you can do for yourself and your loved ones. No matter your age, small changes add up. Start today, eat well, move more, manage stress, and stay connected. Your heart will thank you for it, and so will everyone who cares about you. Take care of your heart at every age and enjoy the benefits of good health for years to come.